For the time being, yes. And the reason for that is this. While some floors are getting enough personal protective equipment, it seems to vary by institution on what criteria you meet to get that. So certainly if you're working in a COVID positive unit that's designated COVID positive, hopefully you're receiving PPE, including a new N95 mask each shift. I'll set aside for the moment the whole issue of the recycled masks, which we remain not in agreement with. We think that people should be given a new N95 each shift because those are still experimental at best. But other units where we still see a problem where a patient may not be considered COVID positive or they're rule out or whatever, and then people being told to wear surgical masks and whatever. No, we think those folks should also be wearing N95 masks. As we have always stated right along that we need to treat every patient in every area as positive in order to have the safest precautionary method of protection for infectious disease. And so if you are in a unit that you're getting the appropriate equipment, that's great. But if you have areas where people are not getting the higher degree of equipment, then we would suggest giving those individuals the N95 masks. And similarly, we leave it up to the bargaining unit committees if they would like also to provide that to other workers within the institution that may not be readily getting the equipment, the masks and shields, if they have additional shields as well that we've been distributing out this past week. They are welcome to go ahead and give that to their colleagues if they feel that they have not been adequately protected as well. And lastly, if they feel like they want to keep some aside, knowing that if they run into problems down the road or other issues that they have a backup supply, that's fine. So we leave it to the individual committees. But again, keep in mind the goal here is a precautionary principle in which you go to the highest level of infectious disease coverage for throughout the institution. So yeah, we'll continue to order. We still have I think an additional 30,000 masks coming in. I mean, we may very well do another 20,000 order this week just to be on the safe side. We had roughly 11,000 plus shields come in. I don't think we'll reorder on those because they seem to be coming in manufactured throughout the state and other organizations readily, so that seems to be okay. The gowns I know are an ongoing problem, but apparently there is a couple of different industries, including one in Springfield, Mass, that are going to be doing the gowns. So I'm hoping that while this week is bad, that changes by next week relatively quickly. We are trying to get some gowns out to people that we were able to get our hands on, but that's pretty limited and difficult to get. So for the time being, the short answer is yes, we're going to continue to order. Precautionary principle is where we're at, and until things change dramatically, that we'll make sure we have a supplemental supply for our members. And we have also, because of donations, we had a PayPal donation put up. We've gotten external donations, and as a result of that, we've expanded it out to non-M&A members as well, being able to supply some to some nursing homes, some non-union hospitals, some other areas that we've been in contact with a lot of people calling the organization, so where we can also provide some additional protective equipment to them, we have done so with the gracious help of some outside folks and donations. So in Massachusetts, you probably have seen that we're, I think, third in the nation right now in terms of our percentage of COVID positive patients, and still considered a relative hotspot compared to a number of other states. But that being said, it's nowhere near the level that it was in New York, obviously, which is a good thing. But we're still running probably between 150 and 200 deaths a day. That's not something to sneeze at, obviously. That's a significant issue. We have a very high number of patients still in the intensive care unit. We're still seeing testing is increasing, but as a result of increased testing, we're also realizing there's an increased number of COVID positive people in the public. So I think based on what other states have seen that have been before us, like New York and other countries, the expectation is that we'll be in the surge through this week, possibly the beginning of next week, and hopefully at that point we'll start to see that number drop, both the number of admissions but also hopefully the number of deaths, begin to wane off. And I also think that there's a bit of good news in that even though we've been in the surge because we were later in the process, we got to learn quite a few beneficial aspects of treatment plans and the ability to try to keep people off the ventilators. So the big fear that we were going to run into and run out of ventilators has not happened. people shouldn't be foolish, all right, and just, again, suddenly have a big surge of patients again. But nonetheless, the treatment plans to keep people off of vents, the expansion of the ICUs, the retraining and redeployment of other staff to help has gotten us so far through the surge pretty well. And hopefully in another week or so, we'll be on the other side of the surge coming down. Does everything return to normal? No, clearly not. We don't have a vaccine, we don't have a cure. And I think that's part of the larger discussion about then what happens in the public. How do businesses reopen? How does the public begin to work back into a more normalized schedule and work environment without giving us right back into a problem of a surge again? And those are things that everybody will be grappling with. What we are seeing the beginning conversations of, which is going to be important for us to work with and come up with strategies with, is the hospitals beginning to think about, okay, all of these elective surgeries that we canceled in order to, free up the hospital of space and also to make sure we didn't have these patients in the hospital when all the COVID patients came in. They're going to want to now do all those elective cases. That's twofold problem. One is not doing it too early where you actually put those patients at risk. Number two, having a mechanism and a staffing ability to do that when all of these folks that were working in the ORs and whatnot have been redeployed to help in the ICUs, suddenly taking away all that support from the ICU nurses and then opening up the ORs becomes a problem. And particularly if you ratchet them up quite fast and expect them to work additional hours to cover all the cases, that's stretching the staff very, very thin. And if, God forbid, a patient has a problem out of the OR, where is it we expect them to go but into the ICUs, which are obviously overburdened with COVID patients still. So no, we shouldn't go right back to business as usual, and we hope that we're going to certainly be demanding that there be some very thoughtful planning about how we reopen up for the safety of both the patients that come in as well as the ones that are already there, and for the staff that have been stretched to the limit already. And if we begin to do elective surgeries, I would certainly expect that the state would return then the waiver that they had passed on the staffing limits law, and also the mandatory overtime should be reversed. If we're going to start doing business as usual surgeries, then those need to be off the plate, because otherwise we're allowing people to just be put into unsafe and compromised positions. So I imagine that conversation is going to start taking place in the next 2 weeks. Yeah, it's obviously wrong. The Division of Insurance has put out a memo, I think it was on April 17th or around that time, that made it very, very clear from their perspective, from the point of the emergency of the pandemic was called in the state, that anybody that is positive working in any environment like a hospital or first responders, or there's a whole, essential services environments where you're exposed, that if you come up positive, you'll be treated as presumed to be work-related. So you should be able to get workers' comp. A lot of the hospitals are self-insured. It's not done through the state, so they have their own vendor handling these claims. What I would suggest to you is if you are not getting immediate response, and actually, frankly, I would just suggest to you that you email to your occupational health and the vendor that you will be submitting a claim to the state, and just have something, an email that you can keep for your record, then go right to the state site for putting in a claim for workers' compensation, so you have it documented and you start the clock rolling from there. And if you're a nurse or anybody in the healthcare environment that's been exposed to COVID-positive patients, you should be presumed to be work-related and receive those benefits. So yeah, it's unfortunate. I have heard from a number of organizations that employers would argue that potentially that you got it in the community, which is, frankly ridiculous at this point, given how we commingled patients, shoved people on shuttle buses, and frankly, we put shelter in place early on, or whatever we called it in this state. We limited the circle of your people that you interacted with, and we stopped a lot of public meeting. So, and we have masks on and everything. So the likelihood of you getting exposed in the community when you have such a small circle of people that you're around versus going into the healthcare setting, which is a literal petri dish, is kind of ludicrous at this point. It isn't whether or not your patient was positive. That really, in some ways, doesn't matter at this point, because it was throughout the institution with a lot of patients being admitted that weren't COVID positive then turned up positive. So we don't know even among the patients that we took care of and among the workforce that's roaming around the building, tracking the virus around. You could be working with a colleague that didn't know that they were positive, and then they've gone ahead and touched all the doorknobs and everything else, and you were right behind them. So it may not even have been a patient that gave it to you. It could have been an unknown colleague who was asymptomatic for days and didn't know that they had caught it from somebody, and lo and behold, that you caught it. So yeah, absolutely, you should be considered presumed to be work-related as far as COVID positive, and you should go right to the state, notify your employer, but go right to the state and make the claim. In the state claim, it will actually ask you where you're employed so that the employer will be notified as well, but get the clock rolling right away. And I also want to mention, while the Division of Insurance went ahead and put this memo out, the reality is we are filing, along with a number of other groups, legislation that would be called presumption legislation that would make it clear that anybody in the essential services that went up COVID positive would be presumed to be work-related, because there are so many out there at this point. If you've been deemed an essential service and went ahead and had to go to work and whatever, then of course if you come up positive, that you should be deemed then presumed to have been work-related. We want that legislation passed. There are two bills right now. One is Senate 2606 and the other is House Bill 4611. We're trying to modify some of the language in them because it didn't cover all workers in these areas, and we really feel obviously it shouldn't matter. If you're in a hospital and you were cleaning the rooms, it didn't make you any less exposed, right? So everybody should be covered. So we want to make sure it includes all the healthcare workers. But those two bills are a very good start and would make sure by legislation that it's deemed positive. If you come up COVID positive, that you're presumed to have done so at your work setting. So as I said, make the claim through the state. The Division of Insurance has made it clear their view on it. And again, this legislation would, I hope, cover any of the problems that we have falling through the cracks, or quarantine issues, or anything else that's related to it. And you certainly can make calls to your reps and senators and ask for their support of these pieces of legislation. I think, what we're going to face in the coming weeks is this reopening idea, right? And the concern that everybody needs to have, obviously, is that nobody could do anything foolish and put us right back in square one again. But then again, everybody understands that there has to be a way to try to work in this environment while being smart about how we approach it so we don't overload our hospitals again. Particularly, there's probably a lot of people that have been waiting that have other health-related issues that have not dealt with them because of this time frame. That can't happen indefinitely either, and that's a recipe for disaster as well. So we do need to figure that out, but we need to do so in a smart way and not a way that's dangerous for the workforce either. And I know that the governor also called the school system, which was good, but we can't see that the kids all get together in summer programs either right now, so we'll have to anticipate that happening over the summer. And then how will they go back to school in the fall? I mean, I think what we're going to all have to think about is, how do you reopen the society, the economy, the workplaces in a way that's smart relative to a pandemic that is extremely contagious, COVID-19, that we do not have a vaccine with, and we won't have one for quite some time, number one. Number two is we don't have the depth and breadth of testing that we would like to have, and that's because everybody's trying to create it at the same time. So it's not necessarily to assign blame, but it's just a reality. To get it up to speed, to be able to test easily and readily everyone is not going to be in place immediately. So that's a limitation that we have as well. And the spread factor, the contagious factor of this disease remains relatively high. So with all of those things in effect, how do you still open up the economy and do it smart? Social distancing is going to have to remain in play. I think probably we're going to have to think about maybe split sessions and those types of things. Maybe the schools have to look at doing double sessions instead, where one group comes in earlier than another group in order to diminish the number of people in one location at one time. Maybe work schedules, for businesses. In the healthcare environment, we're used to that. We work 24/7, so we're already split sessions and schedules. Other industries are not, but they might stagger their work groups so that at any given time there's a less number of people in a building. They could get the work done, but they just change the way it's done. I think if that type of thinking is utilized and the public remains vigilant and smart, then we can keep the number of people being admitted for COVID to a stream that's manageable. And in that way still be able to treat the other. I mean, people are still having heart attacks. People are still having babies. People still break legs and have car accidents. We still need to be able to provide that care as well. So I think that's really where we are in the next couple of weeks, is coming down from the surge, and then not being stupid, not seeming, thank God it's all over, let's reopen and it's all over. It isn't. And I think most of the workforce in the healthcare environment knows that if you don't find a really good way to do this, come fall, when people don't have the appetite anymore for social distancing and influenza hits and COVID's still there without a vaccine, we'll have, a problem as big as, if not worse in some ways, than what we have now. So the next few weeks and the planning around it and the thinking around it and how we reopen is extremely important.